Hi everyone, and welcome to today's webinar, The ABCs of Administrative Law and Public Health Practice. This webinar is part one in a two-part series brought to you by ChangeLab Solutions, the Centers for Disease Control and Prevention's Public Health Law Program, and the National Association of County and City Health Officials. Today's topic, administrative law, touches nearly every aspect of modern life as well as the everyday practice of public health. Administrative law can be a powerful tool for the implementation and enforcement of public health policies and programs, from retail licensing and lead paint inspections to quarantine orders and eligibility and disbursement decisions for public benefits like Medicaid and the Special Supplemental Nutrition Program for women, infants, and children. Because of the reach and intensity of these powers, it is important for public health practitioners to understand administrative law and recognize the key principles and procedural rules when exercising public health powers. Today's presentation is a preview of forthcoming on-demand trainings through the Public Health Law Academy. The Public Health Law Academy, supported by the Centers for Disease Control and Prevention, provides a deeper understanding of the use of law and policy to improve population health outcomes. Developed in cooperation with ChangeLab Solutions, the free and easy-to-use online trainings offered by the Public Health Law Academy are essential for all public health professionals. You may reach the website for the Public Health Law Academy at www.publichealthlawacademy.org. Before we get started, I just want to let you all know that there is a question and answer box on the left-hand side of your screen. You can submit questions to speakers on the left-hand side. We plan to have a question and answer session at the end of the presentations for today. And also just a quick note, only you could see the questions that you submit, so feel free to submit any questions that are on your mind. In addition, I want to just mention that a recording and slides from this presentation will be available within the next week or so on ChangeLab's website, and more information regarding this will be given to you following the presentation. Now that we have that out of the way, I just want to introduce the speakers. So again, my name is Jeff Mongula Jr. I'm a Senior Program Analyst with the National Association of County and City Health Officials, otherwise known as NACHO, and I'm excited to be moderating today's webinar. In my role at NACHO, I lead our work related to public health law, which includes activities focused on assisting local health departments as they address issues related to public health law and policy. This includes the development of tools and resources, the management and coordination of local public health law-related work groups, and other activities that build the capacity of local health departments in this field. Now I'd like to introduce our two speakers from today's webinar. We're joined by Matthew Penn, the Director of the CDC Center for State, Tribal, Local, and Territorial Support's Public Health Law Program, or PHLP. In his role as PHLP Director, he leads a team of legal analysts responsible for the agency's efforts in legal epidemiology and workforce development to support the understanding and use of law as a public health tool at the state, tribal, local, and territorial levels. Mr. Penn and colleagues have been shaping new directions for the public health law community with a new book entitled The New Public Health Law, A Transdisciplinary Approach to Practice and Advocacy, and research and publications including Better Health Faster, The 5 Essential Public Health Law Services, Policy Surveillance, A Vital Public Health Practice Comes of Age, and A Transdisciplinary Approach to Public Health Law, The Emerging Practice of Legal Epidemiology. Prior to entering federal service, he served within South Carolina's Department of Public Health and Environmental Control as an advising and litigation staff attorney with extensive experience in the areas of emergency preparedness, disease control, and environmental health. Also joining us today is Alexis Eto, a senior attorney at ChangeLab Solutions, where she provides trainings, technical assistance, and legal research to government agencies, community-based organizations, and public health advocates across the country, working to create healthy, thriving, and just communities. She also leads the organization's work focused on schools, child care, and family supports. Before we begin, I want to spend a few minutes providing some background information regarding our content providers today. ChangeLab Solutions. ChangeLab works across the nation to advance equitable laws and policies that ensure healthy lives for all. ChangeLab prioritizes communities whose residents are at highest risk for poor health. Its interdisciplinary team of lawyers, planners, policy analysts, and more works with neighborhoods, cities, and states to create thriving communities. CDC Public Health Law Program. The mission of the CDC's Public Health Law Program is to advance the use of law as a public health tool. They do this by creating resources that can be used to influence public health outcomes, for example, through legal epidemiology, or mapping and evaluation, workforce development opportunities, including webinars, trainings, training materials, fellowships, internships, and externships, and finally through partnerships and outreach. The Public Health Law Program does all of this to serve CDC programs as well as state, tribal, local, and territorial communities. To submit a request or to learn more about public health law, you can visit the program's website at www.cdc.gov/PHLP. NACHA. So local health departments are the backbone of the public health system in the United States. As a leader, partner, and catalyst and voice for LHDs, the National Association of County and City Health Officials advances the work of local health officials and their staffs to create healthy, thriving communities. The following is a list of some of the ways NACHA supports its members, including the creation and maintenance of partnerships, the provision of networking opportunities, and the production of tools and resources. Just also want to give you a few disclaimers before we begin. First, we want to remind you that the information provided in this training is for informational purposes only and does not constitute legal advice. ChangeLab Solutions does not enter into attorney-client relationships. Further, while every effort has been made to verify the accuracy of these materials, legal authorities and requirements may vary from jurisdiction to jurisdiction. The contents of this presentation have not been formally disseminated by the Centers for Disease Control and Prevention and should not be construed to represent any agency determination or policy. I will seek the advice of an attorney or other qualified professional with any questions you may have regarding a legal matter. So let's get a little bit more into the meat of today. So first I want to talk to you about the public health law competencies. So individuals who work as public health practitioners, lawyers, and policy experts in state, tribal, local, and territorial health departments need measurable skills to move their careers forward. The CDC's Public Health Law Program developed a public health law competency model to help guide the career trajectories of practitioners in the field. This module of the Public Health Law Academy, that being administrative law, will cover the 4 competencies listed on this slide to build skills for public health practitioners in public health law. We want to note that these are not the objectives of this course, but general public health law competencies suitable for the workforce and public health students. The 4 competencies include defining basic constitutional concepts that frame the everyday practice of public health, describing public health agency authority and limits on that authority, identifying legal tools and enforcement procedures available to address day-to-day public health issues, and distinguishing public health agency powers from those of other agencies, legislatures, and the courts. This training is intended for public health professionals at all levels of their career, from students to entry-level staff to supervisors and executive-level managers. So what are we going to discuss today? As I mentioned earlier, this is the first webinar in a 2-part series that provides a preview of forthcoming on-demand trainings that are free and available online through the Public Health Law Academy. Today, we will first define what administrative law is and talk about how it shapes health outcomes. Then we will discuss the sources and limitations of public health agency powers. And finally, we will explore why administrative law is important to public health. The concepts discussed today will lay the foundation for the second and final part of this training, which takes a deeper dive into how administrative law plays out in practice in state and local health departments. Part 2 explores the procedural requirements for local agency rulemaking and enforcement actions, as well as best practices for state and local public health agencies. So we encourage you to tune in. So again, we will save some time at the end of this presentation for Q&A with our speakers. And again, to submit questions, you'll find the box on the left-hand side of your screens. So let's get started. I'm going to hand it over to Alexis for her presentation. Alexis?
Great, thanks, Jeff. So I wanted to get started by just defining a few key concepts and answering the question that is really central to the rest of today's conversation, which is, what is administrative law? So when we refer to administrative law, we are referring to the legal doctrines that govern the organization and activities of administrative agencies, We'll explain what administrative agencies are shortly, but I wanted to first take a moment to unpack what this definition actually means. For those of you who were at NACCHO Annual last year in Orlando, Florida, you might recall the fantastic keynote presentation around messaging and framing. I often think of the metaphor that Nat Kendall Taylor of the Frameworks Institute used to describe public health, which he explained was like a GPS navigation. Both chart the most effective route to get us safely from where we are to where we need to go, and use the power of data to move towards solutions. So if we think of public health being the GPS system, administrative law acts as the guardrails that keep public health agencies on the right path when implementing a new public health program or when issuing licenses or inspecting facilities to assure compliance. So sticking with the GPS and guardrails metaphor, administrative agencies are the ones driving the car or riding the bicycle or whatever mode of transportation that uses the GPS tracker and guardrails. In other words, or in more technical terms, an administrative agency is a government body that sits within the executive branch of government and is responsible for administering certain laws. One type of administrative agency is public health departments, including the Department of Health and Human Services at the federal level, as well as state and local departments of health. I mentioned that administrative agencies sit in the executive branch of government because that is really foundational to understanding their unique roles and responsibilities, as well as the limitations on their authority. So a recurring theme throughout today's conversation, and one of the principles that really is foundational to public health agencies, is the separation of powers. Remember that the U.S. Constitution created 3 branches of government: the legislative, executive, and the judicial branch, each with its own unique functions and sets of responsibilities. As you probably recall from high school civics, the structure of government ensures a system of checks and balances so that no single branch has too much power. So as I mentioned earlier, administrative agencies are situated within the executive branch. When we talk about administrative law, then, we're really talking about the law that applies to the executive branch, and this is true at federal, state, and local levels. One of the primary purposes of administrative law is to ensure that administrative agencies don't infringe on the powers of other branches of government or exceed the scope of their authority when enforcing laws against people and businesses. So what do administrative agencies do? One activity that agencies commonly engage in is in adopting rules and regulations. A regulation is a law adopted by an administrative agency. You might also sometimes hear the term rule in addition to regulation, and these terms mean the same thing and can be used interchangeably. For purposes of this training, though, we use the term regulation. And we'll talk more about how agencies make rules and regulations in the second webinar. So at this point, some of you might be thinking, wait, but I thought only the legislative branch was authorized to make laws. And if so, you're right, to some extent. And that's because the U.S. Constitution expressly grants all legislative powers in Congress. This means that only Congress has the authority to make federal laws. The same is true at other levels of government. State constitutions typically vest the power to make laws in the state legislature, and in many cities and counties, the city charter vests the power to make laws in the city council or other legislative body, such as a board of aldermen. However, a legislative body can delegate its power to make laws to administrative agencies in the executive branch of government. So note that administrative agencies don't have any inherent power to make laws. This means that an agency, including a health department, can make regulations only when a legislative body has given the agency that authority. As Matthew will explain shortly, this delegation of authority is typically spelled out in a piece of enabling legislation or in a foundational document, such as a constitution or a municipal charter. An important distinction that I want to point out is that a regulation is not the same as legislation. Although both have the effect of law, there are several key differences. So first, a legislation is a law introduced and finalized by a legislative body, such as Congress, a state legislature, or a city council or county board of supervisors. Regulations, on the other hand, are drafted by administrative agencies who have subject matter expertise. That expertise is needed for regulations because while legislation sets the broad parameters or the big picture for what the legislative branch wants to have happen, It often relies on agencies to fill in the details. The regulations help fill in the details of legislation by specifying how enforcement will work or by clearing up ambiguities. And this is just, I should note, a very high-level overview of these distinctions. If you're interested in examples or taking a deeper dive into the important differences between legislation and regulation, I encourage you to check out the Public Health Law Academy's Training on the Structure of Government, which covers this more in depth. The key thing to remember here, though, is that administrative agencies play a central role in adopting regulations, not the overarching legislation, which is a power reserved by Congress. Okay, so that was a lot of information. So just to take a quick step back, this is just a quick question about which of the following are regulations. So in a moment you'll have a chance to make your selection, but the answer choices are A, laws adopted by Congress, B, laws adopted by a state legislature, C, laws adopted by a city council, D, laws drafted by an administrative agency like a local health department, or E, answers A, B, and C. Okay, so if you pick D, you're correct. As we just learned, laws adopted by administrative agencies pursuant to their delegated authority are known as regulations. In addition to adopting rules and regulations, some administrative agencies are also responsible for implementing, enforcing, or ensuring compliance with those regulations by issuing licenses and benefits, conducting investigations and inspections, and initiating enforcement actions against people and businesses. These four activities are typically referred to as an agency's regulatory activities or responsibilities. As we mentioned at the beginning of this training, administrative law governs many aspects of public health practice. For example, when it comes to food safety, state and local health departments are the first line of defense in ensuring the safety of our food. But there are certain legal and constitutional requirements they must follow when conducting health inspections or monitoring compliance with food safety regulations and responding to outbreaks when they occur. Similarly, health departments play an important role in protecting the public health through retail licensing programs that reduce youth access to harmful substances such as alcohol or tobacco and limit the negative health effects of tobacco usage or alcohol consumption. Administrative law ensures that state and local agencies follow proper procedures when issuing and enforcing retail licenses. The same is true when it comes to creating and enforcing environmental policy, such as regulating pollution, monitoring air quality, or banning or limiting the use of certain chemicals. And finally, federal, state, and local health agencies play a crucial role in preparing for, responding to, and recovering from the emergencies that threaten the health and safety of residents. And we're seeing this playing out real time here with public health efforts to stop the spread of the current coronavirus or COVID-19 here in the U.S. So administrative law is an important safeguard for ensuring that any mandatory screening or quarantine or vaccination is reasonable, that is, it's effective in preventing the spread of disease and does not unduly infringe on individual liberty interests. We explore what responders need to know about the law when preparing for and responding to public health emergencies in another academy training, Public Health Threats and the U.S. Constitution, which I encourage you to check out if you're interested in learning more about this topic. I'm sure many of you can think of examples from your own experiences and practice how administrative law might be playing out in your everyday experiences. So I wanted to just take another quick moment to have you reflect on and share some of the regulatory activities that your local health department engages with. So if you can type those in to the screen on the next slide. Okay, so as you can see, the regulatory authority of state and local governments is quite broad. For example, this is a snapshot from NACCHO's 2016 National Profile of Local Health Departments, which illustrates the range of regulatory activities undertaken by local health departments. As you can see, this includes licensing and inspecting food service establishments, schools and daycares, as well as septic systems. Before I hand it over to Matthew, I just wanted to quickly recap what administrative law is because we've covered a lot here in the first few minutes. So administrative law spells out the specific procedures that public health agencies must follow when engaging in the everyday activities that we just discussed. Public health agencies play a really powerful role in shaping population health outcomes through a wide range of public health interventions. However, there are important limitations on this power. We've talked about one of the reasons why limitations are important, to ensure appropriate separation of powers so that agencies don't exceed the scope of their authority. And we alluded to another when we talked about emergency preparedness and the importance of protecting individual liberty interests. So now I'll pass it over to Matthew, who will talk a bit more about these rationales and more in a moment. Thank you.
Thanks so much, Alexis, and thank you everyone for calling in to today's webinar. So now that we have some foundational understanding of what administrative law is and what administrative agencies do, let's explore a little bit the limitations of those actions by looking at some of the key administrative law doctrines that public health agencies must keep in mind and follow when engaging in the regulatory activities that we just discussed. And we're going to do a little case study here with Jackie, who is interested in some sort of smoke-free policy in her jurisdiction, and we're going to follow a little bit of what she goes through as she explores this area of administrative law and in public health practice. So Jackie knows, because she tuned into this webinar, she knows that the first crucial step in this process has to be the delegation of authority by a state or local legislative body. This delegation of authority is generally established in state legislation, such as a public health code, the municipal or county charter, or some sort of local legislation. The idea is that the legislative branch gives authority to the executive branch to make rules and regulations. For instance, here's an example from New York City's Smoke-Free Air Act, which grants specific authority to the Health Commission to adopt rules necessary to implement and carry out the provisions of the Act. While this is an example of an express grant of authority, note that in many jurisdictions, local health departments do not have the power to make regulations at all, because the structure and responsibilities of local health departments can vary widely. It's very important for local health officials to consult with their legal team to confirm their rulemaking, regulation passing authority, and the best practices and procedures to use before embarking on the rulemaking process. So, assuming that Jackie's health department has the authority to adopt smoke-free workplace regulations, Jackie will need to consult with her legal team to determine what steps she must follow. And of course, this is exactly where an understanding of administrative law is particularly important to Jackie in her endeavor. So generally, there are three basic rulemaking procedures that administrative agencies must follow at the federal, state, and in some cases, the local level. These are the laws that put guardrails or limits on agencies' rulemaking authority. And as we'll discuss, there are a lot of similarities between rulemaking procedures at the federal and the state level. However, there is significant variation at the local level. So as we mentioned earlier, many local health departments do not have authority to make regulations at all. Even if they do, however, they must operate without any mandatory overarching legislative guidance on rulemaking procedures. In fact, several large cities in the U.S., including Chicago, Los Angeles, Houston, and Phoenix, lack a procedural ordinance to direct the agencies on the process to follow to pass those regulations. So, how do local laws, or the lack thereof, apply to Jackie? So the first thing that Jackie should do is work with her legal team to learn what procedures and best practices they typically follow in writing rules. Often the procedures used in jurisdictions without overarching procedural legislation track federal and state administrative requirements, which are designed to promote fairness, accountability, and due process. And without getting too far in the weeds, we're going to provide a quick snapshot of how federal and state administrative requirements promote these three principles just mentioned: fairness, accountability, and due process, part of the backbone of administrative law. So starting at the federal level with the U.S. Constitution, if you've taken any of the trainings in our Introduction to Public Health series, you may recall that the U.S. Constitution determines the scope and limitations of the federal government's authority, including federal administrative agencies. So we've already talked a little bit about one of the ways in which the Constitution limits agency authority, and this is through the separation of powers. And this means that agencies cannot infringe upon the responsibilities of the other branches, including the legislative branch and the judicial branch that runs the courts. So this has a very many important implications for the passing of rules or regulations at all levels of government for two reasons. First, agencies can adopt regulations only when a legislative body has given them the authority to do so. And secondly, agencies cannot act outside the bounds of that specific delegation of authority. In other words, if a local ordinance gives an agency authority to adopt regulations implementing the Locality Smoke-Free Air Act, the agency could not, for example, adopt regulations banning flavored tobacco products. Regulation of flavored tobacco products would be outside the scope of the legislative body's delegation of authority. So the other way in which the Constitution limits agency authority is through due process. Under the 5th and the 14th Amendments to the U.S. Constitution, the government cannot deprive individuals of life, liberty, or property without the due process of law. So what does that mean, due process of law? Due process really looks at the fairness and reasonableness of government actions that may affect life, liberty, or property interests, like revoking a license, imposing a fine or penalty, or shutting down a business because of a health or safety violation. So let's look at an example. Let's say a health department received a phone call complaining about food safety practices at a local cafe. The health department couldn't just permanently close the cafe based solely on the phone call. The health department would need to conduct an inspection, notify the restaurant owner that they are violating food safety laws, and then give the cafe owner an opportunity to fix the issue and address the allegations. These additional steps are all part of what we call procedural due process. Note that public citizens can legally challenge state and local health agencies' failure to follow proper administrative procedures. For example, they can challenge the notice that is given of an alleged violation and whether or not they had the opportunity to respond or remedy an issue. So it's really important to understand the legal requirements set out in the relevant administrative law doctrines in your state. So another important guardrail, as we mentioned earlier, are these Administrative Procedures Act. At the federal level, the federal APA was passed by Congress in 1946 to make sure that agencies acted in line with constitutional concepts we just described. It ensures relative uniformity among federal agencies and spells out the procedures they must use when developing regulations or conducting other administrative actions and proceedings. Note that the federal APA, or Administrative Procedures Act, this law applies only to federal agencies, not state, not local. It's also important to look at the federal legislation that defines or expands a particular federal agency's powers. This is important to understanding what the scope and the limitations of that regulatory authority entails. For example, the Federal Clean Air Act gives the Environmental Protection Agency, or EPA, authority to regulate motor vehicle emission standards for, quote, any air pollutant which may reasonably be anticipated to endanger public health or welfare, end quote. So, although the EPA has broad authority to administer regulations in promoting the Clean Air Act, it must follow certain procedural requirements. For example, by adequately demonstrating that the air pollutant it seeks to regulate could cause or contribute to air pollution that endangers the public health. And this is tied back to that enabling legislation. Finally, sometimes the scope of agency authorities may be vague, and sometimes we get the judiciary and the courts involved to interpret whether or not an agency has exceeded its authority or has stayed within the bounds of that delegated authority. And then once the judiciary does this and issues some sort of ruling, the court interpretations of these can be binding on the agency, on other parties, throughout the jurisdiction. And we call this the case law as determined by the judiciary. So, quick survey here. Do federal constitution concepts apply to Jackie? And I think as we've seen through the previous slides, certainly separation of powers applies. That is a constitutional concept. And the constitutional concept of due process also applies. So let's turn to state administrative law, which is generally analogous to the federal doctrines that we just discussed. For example, state constitutions may be in sync with the U.S. Constitution and spell out how state and sometimes local administrative agencies are organized and how they operate. Some state constitutions also establish the agencies themselves. And again, this is going to vary from state to state, and you want to read up on yours if you have any questions about that. So when it comes to the APA, or the Administrative Procedures Act, like processes, state legislatures have typically adopted legislation that is pretty similar to the federal APA. And like the federal APA, the state legislation outlines rules for how state agencies operate, how they are allowed to regulate, and how they should conduct hearings and appeals, and even down to the details of how they go about making those rules and turning them into binding law. And finally, I want to mention state statutes and judicial decisions, because the same thing happens at the state level as the federal level, because the statutes and the decisions also carry the force of law. Similar to limitations on federal agency authority, it's important to look at relevant state statutes or legislation that define or expand a particular state agency's powers. And, as we mentioned earlier, sometimes it's up to the courts to figure out whether an agency has exceeded that authority. Judicial decisions made by state courts are an important source of administrative law. For example, in Jackie's case, it's important to be aware of any decisions interpreting the laws pertaining to the local health department's rulemaking authority. She should be aware of what those decisions say and whether they affect the department's ability to issue smoke-free regulations. And of course, in Jackie's case and others, it may be wise to check with the agency attorney to understand. Sometimes you read judicial opinions and it's hard to figure out what they're saying. So sometimes it's good to talk to an attorney to determine what the heck's going on in some kind of judicial opinion. So how does this work in my state? We have some resources here. To learn more about how administrative law works in your state, visit your state or Secretary of State's website. Many states have offices of administrative law or an administrative law division or an administrative law court division that provides information about rules, rulemaking, and the public meeting calendar. We have one on here as well. The uslegal.com is a free online resource that also provides links to State Administrative Procedures Act. So, big question, why is administrative law important for public health? So before we conclude, I want to take a step back for a second and highlight a few of the reasons why it is so important for state, tribal, local, and territorial health departments to have a foundational understanding of administrative law. First, as we have discussed, state, tribal, local, and territorial health agencies are themselves administrative agencies that engage in a wide range of regulatory activities, and they are therefore directly subject to administrative law doctrines adopted in their jurisdictions. Remember, administrative law acts as guardrails that shape what health departments and other agencies can do, and on a day-to-day basis, they affect how you go about your business So it affects your agency and your day-to-day work. Secondly, advancing the social determinants of health and public health work relies on a wide range of agencies other than state, tribal, local, and territorial health departments. For example, at the local level, common agencies that impact public health include parks and recreation, housing, planning, public works, etc. Knowing who those agencies are and what they are doing is important to coordination and collaboration. Understanding administrative law can help practitioners in state health departments identify how they can influence or to participate in regulatory process of other agencies, for example, by supplying data, supplying evidence, advice, or assistance to the other agencies that are dealing with things that affect the community's health, or by collaborating directly through some sort of health and all policies framework or interagency work group. And understanding that those administrative law doctrines affect them just like they affect the health department can give you a good understanding of what their scope authority is and what they can and what they can't do. For example, a number of different multidisciplinary agencies at the federal, state, and local level play an important role in ensuring students have healthy school meals. At the federal level, the U.S. Department of Agriculture, a federal government agency, sets minimum standards for food sold at schools participating in the National School Lunch Program. State agencies and local school districts also have opportunity to influence public health with the authority to impose more rigorous and/or additional nutrition requirements. And of course, all of these agencies are doing this through the lens of administrative law and the doctrines we're talking about today. And finally, still administrative actions can profoundly impact the nation's public health. The impact can either be vertical, which is when a regulation is adopted at increasingly higher levels of government, or horizontal, which occurs when a regulation is adopted by other agencies at the same level, or agencies at the same level engage on the same topic. And this results in the regulation spreading out throughout the state or the nation. In fact, many public health innovations have stemmed from local agency action. Consider, for example, local innovations in tobacco control, one of public health's 10 greatest achievements. We have seen this throughout Massachusetts, where local boards of health in Boston and other Massachusetts municipalities issued rules banning the sale of cigarettes at pharmacies, as well as in West Virginia and Michigan, where county public health agencies implemented local smoke-free workplace laws that expanded the scope of their state's smoke-free workplace laws, really to cover all indoor public spaces. So administrative law can be used to spread healthy laws and healthy regulations at the local level, and then maybe up to the state level and maybe to the federal level. Another example of this, food retail regulations. New York City's Board of Health was the first government entity in the U.S. to ban the use of artificial trans fats, and the first to require menu labeling. Both became widespread throughout the country, and now both are federal law. This is an example of both horizontal and vertical influence. By understanding administrative law, public health agencies have an important and powerful opportunity to help shape and advance the health of their communities and the rest of the nation. So with that, I'll turn it back to Jeff for recap, and then we will head to the Q&A part of today's presentation. Thanks.
Thank you both Matthew and Alexis for your presentations. Those were great. As a quick recap, we explored what administrative law is, what the sources and limitations of agency power are, and how administrative law is important to public health. As Matthew mentioned, we're up to our Q&A portion of our presentation today. Again, I would like to invite participants to ask any questions of our panelists related to their presentations. A reminder, you can submit your questions through the Q&A box on the left-hand side of your screens. And it looks like we already have a number of questions in our queue. So let's just go ahead and get started. So the first question I have for our presenters is related to just the potential conflicts between regulations and legislation. So the question is, can regulations conflict with enabling legislation? If not, what happens if that occurs? I'll leave it open to either Matthew or Alexis to answer.
Thanks, Jeff. This is Matthew. So the answer to this question stands as kind of one of these guardrails, and the base answer to this is no. Regulations promulgated and passed by an executive agency cannot conflict with the enabling legislation that allowed those rules to be written. And it's part of why when we talked about Jackie's sort of journey through this process of administrative law, the very first thing we talked about was looking really closely at that delegation of authority. So what is it that the legislative body wants the executive agency to write rules about, and making sure that you stay within that bound of authority. And not going outside of that, and certainly not conflicting with anything that's in that underlying legislation. Now, I have to say, sometimes the enabling authorities, so that statute or that ordinance passed by the legislative body, sometimes those are super complex and can be dozens of provisions and dozens of pages, maybe hundreds of pages. So this is one of those places. I think the second step we suggested was to get with legal counsel, particularly if that underlying legislation is particularly complex, to try to avoid the issue that the questioner raises quite directly, which is you don't want to write anything in the reg that conflicts with the statute, because then it's vulnerable to lawsuit and being overturned as being in conflict with that underlying authority. I don't know if, Alexis, you have any other comments?
Sure. Just to add to that, I think the example you mentioned earlier with the EPA and the Clean Air Act is a great example of an enabling statute that kind of outlines the scope of authority for agencies, and that's where the separation of powers kind of also comes into play, where agencies can't act outside of that authority and start regulating things that the enabling legislation didn't grant them the power to do so, and again, where courts kind of come in if needed to interpret kind of what the scope of that authority is. So even if it's a broad grant of authority like the Clean Air Act, it's important to kind of act within those set parameters.
Excellent. Thank you both. All right, our next question, and this might be a little bit more of an opinion, just answer how you see fit. So in your opinion, should all laws, and I believe statutes is the intent, have associated rules and regulations to flesh them out?
Yeah, I think that really it's kind of an easy answer. The answer is no. If you're really talking about all laws, there are many laws that exist within statutes at the federal or the state level, or ordinances at the local level, that are they're very clear, they're very detailed, and they have all the language that they need to be implemented, right? That's really the fundamental thing about rules and regulations is we use them to flesh out the details so that what the legislature wants done can actually be done. It can be implemented because it has some flesh around the bones. So if a statute or an ordinance already has that level of detail, then you wouldn't necessarily need the rules and regulations to flesh out more detail, if that makes sense.
Go ahead.
Just something that I touched on earlier where regulations can really be beneficial is because of agencies' expertise. So oftentimes you'll see regulations when legislative bodies don't have the expertise to draft detailed directions for specific regulatory areas. I think in the public health context, that's a really good example. State legislatures or city councils might not have kind of the frontline experience or expertise to develop some of the health-based standards for contaminants in drinking water, sanitation standards for food service establishments, for example. So think that's one of the reasons why you'll see legislatures frequently delegating that authority to experts in public health agencies to kind of fill in the details that I mentioned earlier of complex public health legislation. Another, I think, reason why regulations are important is that it's often difficult or impossible to anticipate all the possible circumstances that might arise after a piece of legislation is adopted. So that delegation of authority allows for flexibility so that administrative agencies can adopt regulations to kind of address conditions or maybe emergencies that the legislature didn't anticipate. And then finally, although regulations aren't necessary to legislation, sometimes they're helpful when legislators don't have the time to really hammer out all the details necessary to address a problem or implement a particular program. So it might just be more efficient for legislatures to pass laws that set a general framework and then delegate that authority to administrative agencies to figure out the most effective way to implement the piece of legislation.
Excellent. Thank you both. All right, so our next question. So just using the Public Health Code as an example, do amendments or changes to that code need to go through a state's legislature? I'll leave it to either Matthew or Alexis.
I can jump in. This is Alexis. If it's changing a law that's been codified in, for example, a public health code, then yes, it would need to go through the state's legislature or the legislative body that passed the law. If it's expanding or strengthening or kind of explaining the details, as I mentioned, filling in the details of the law, then that's something, and granted the administrative agency has been granted that power, that's something that the agency could do through regulatory action.
And this is Matthew. So, and one thing to keep in mind, one of the things that varies across the states is the requirement for regulations to be looked at and approved by the state legislature. So in some states, when a state agency writes up the details of a regulation and promulgates them, one of the steps is it's got to go to the legislature to be approved. That's not true in all states. So even if it's new regulation, it's got to go over. That's an amendment. If it's a change, they have to go over to the state legislature. And that's something to, if you work at the state level, there's something to talk about with your attorney to see if that is part of the process you need to go through in your Administrative Procedures Act.
Excellent. Thank you. All right, so this question is for Matthew. It's based on your presentation. So a quick question on what body was the first to ban trans fat? I think someone just wants that to be repeated.
Yeah, the New York City's Board of Health.
Thank you. All right. So next question, either Matthew or Alexis. Could you discuss the use of zoning regulations for public health aims? For example, on the distance between fast food establishments and schools, and just zoning that out. Can you just go through that a little bit?
This is Alexis. I can just quickly touch on that that zoning laws are traditional and great tool for local governments to use to promote health, as the examples that you named. And I'll just mention that we do have a ton of resources on our website, if that would be helpful, at changelawsolutions.org, if for more information, so we can make sure we have time for all the questions. I don't know if Matthew had any other insights to add.
No, same thing really. Zoning regulations do a lot of things, and one of those is potentially be used to promote health. Keep heavy industries away from housing residential areas. It's one of the ways it can be used. But zoning and planning and all that varies greatly across local jurisdictions. So it's good to check with that office and check with your attorney, if you have a relationship there with your attorney, as to what the rules are for your local jurisdiction.
Thank you both. All right, next question. And this is a question related to kind of our system of federalism. So how is it that a state law can contradict a federal law? An example that they cite is related to cannabis law. Just going through kind of how the two different seemingly contradictory laws interact with one another.
This is Matthew. I think, to take the question on its face, how can they? I guess the simple answer is they just can, right? I mean, state legislatures have their own plenary authority to pass their own laws, and they can pass their laws. And that authority and that power was reserved as part of our constitutional structure under the 10th Amendment of the Constitution. And one of those authorities that was reserved under the 10th Amendment was the police powers to enact laws and regulations regarding the health and well-being and issues of the state. I think the issue becomes whether or not a conflict between those laws ends up causing somebody to file a lawsuit. And you can get into, at that point, then get into issues of preemption, of whether or not the federal law holds or the state law holds, and issues into whether or not there's room for states to maneuver within a federal regulatory scheme, or not maneuver. Is it directly conflicting with, or is there space for a state or local jurisdiction? This happens between state and local jurisdictions as well. Preemption is a huge issue, particularly for public health, and is a bit of a cutting-edge issue right now, and something to pay very close attention to within your jurisdiction. And it's a good idea to look at it through the lens of health impacts. Does this affect health? Health equity? Are there health disparity issues with preemption in my jurisdiction? We have trainings on those. On the issue of preemption, and I encourage you to check out those and learn more if you're interested.
Just as a quick clarifying note too, for folks on the line who might not know preemption by its name, but have probably seen it play out in practice, it's when the law of a higher level of government, so at the federal or state level, for example, overrules or supersedes the law of a lower level of government. So it could do that at the state or local level, depending. But as Matthew mentioned, it's a hugely important topic right now with critical equity implications.
Thank you both. Our next question. So this question is, could you share thoughts on how grassroots organizations without legal expertise can develop plans to leverage administrative law to improve public health, particularly in safeguarding health of lower-income neighborhoods?
This is Alexis. I can speak on behalf of Change Lab. This is something that we provide a lot of technical assistance around. So if this is something that would be interesting, I encourage you to reach out, and we'd be happy to talk more about possible options there.
Thank you, Alexis. All right, next question. Are there some issues that would require action by administrative agencies more so than others?
So this is Matthew. I'm not sure exactly what that's asking. I think in terms of things that would require action, it's really those aspects of administrative law that we would determine to be mandatory on the agency. So, for example, executive agency, federal, state, local level, wants to promulgate a regulation on a particular topic. You pretty much have to follow the Administrative Procedures Act that puts that on you, and so you've got to look at those carefully. So there may be you may have to be required to publish a notice of drafting. We're going to draft a regulation. Just let people know, even before you start drafting. Then you might have to publish a notice of proposed regulation, which is some actual language. And then I think beyond that, then once you promulgate regulations that you're responsible for implementing, you got to implement them. And so whatever the requirements are in the rules that you write, you have to follow. And then in following those, in implementing those regulations, you really are required to be sensitive to and cognizant of all of the constitutional issues that arise when government agencies start acting. So you want to follow procedural due process. You want to make sure you're compliant with equal protection rules in your state. So you want to treat similarly situated people in a similar way, regardless of background or situation or circumstance. That may not be exactly what the question's asking, but that's the first thing that came to my mind. Alexis, do you have other thoughts maybe?
No additional ones that come to mind. I think if that answer didn't answer the question, we'd be happy to talk more and get some more clarity about what the question is asking.
All right. So one last question. And so this question is related to just the practice of enforcement by administrative agencies. So for instance, a local health department, if in the course of doing an activity such as a restaurant inspection or something along those lines, and this likely varies by jurisdiction to jurisdiction, but can there be a duty to alert law enforcement if criminal activity is discovered in the day-to-day activities of an administrative agency?
So this is Matthew, and we would have this question come up occasionally my health department. And I hate to give a lawyer answer, but it really does depend. And it's something that is really good idea for you to look at in coordination with whatever legal counsel you have and get some kind of agency policy down on that issue. In the law, generally, there tends to not be a requirement to act, to do something, but that can vary from jurisdiction to jurisdiction. So, for example, there are generally at the state level, there are statutes that require certain professionals to report child abuse and neglect if they have a reasonable basis to believe that there has been child abuse and neglect. In carrying out duties, even if an agency is not child welfare services, other agencies may become aware of things. So that's an exception generally to the rule that you don't have to do things affirmatively and report things. But those rules are going to vary from state to state. So there may be laws that apply to you and your activities. And you really ought to get some close legal advice there on what those are and how to implement those across what may be a fairly large agency. That's my best answer.
Thank you, Matthew. All right, so we are at the 4 o'clock hour over on the East Coast. But before we close for today, just want to quickly remind folks to please join us on Thursday, March 26th from 3 to 4 o'clock p.m. Eastern for webinar number 2, which will take a more in-depth look into the procedural requirements for local agency rulemaking and enforcement actions, as well as highlight best practices for state and local public health agencies. Just want to bring up this slide, which acknowledges that today's webinar was made possible in part by a cooperative agreement with the CDC. And with this last slide, this concludes our webinar today. Thank you to our presenters and to all of you who joined today. Please take a few minutes to fill out the short survey following this webinar. Your feedback is very important and helps us shape future trainings. Finally, if you have additional questions or are interested in learning more about today's content or the other trainings available through the Public Health Law Academy, you can feel free to email phlacademy@changelabsolutions.org or head to the website www.publichealthlawacademy.org. Thank you very much, everyone, for joining.